Co-Ordinator forum. I'm just going to run through some housekeeping bits and then I'll hand over to Hazel. So if you'd like to introduce yourself in the chat and just let us know which surgery or PCN you're from. If you can keep yourselves on mute, but if you've got any questions, please do put them in the chat and we'll pick them up. These sessions are recorded and they'll be shared with you. And if you can kindly participate in the Menti poll, so that will be after the presentation, we'd appreciate it. It gives us a really useful information for our future sessions. And please also know that this is a safe space and it's a support session for care coordinators. So whatever's discussed will obviously stay in this forum. Just a quick run through the agenda. I mean, we're very, very grateful to Hazel for presenting once more. And this is going to be a focus more on searches, which was a request from our previous forum. So I'm going to hand over straight over to Hazel. Thank you.
Hello. Well, thank you for inviting me back. I obviously did something right. I will apologise before we get going too much. I've not been well, actually, so I've got a bit of a chest. So every now and then I've got a bit of a cough and a bit short on breath. So apologies about that. So thank you for that introduction. We are going to focus to start with, I think, on the searches, which you requested from your last session. So what I'm going to do is I'm going to go into searches that I think are probably going to be useful, interesting for you guys. I'm going to take it right back to basic level because there may well be some of you here who aren't used to running searches, don't know what searches are. So apologies for any of those who are really familiar with searches. It's a really easygoing session. Please do stop me, talk to me, ask me any questions, ask me to repeat anything, show anything else. You know, if we're looking at things that actually they're not within your remit, but there's something that you feel might be, then ask the question and we'll see what we can do to cover that for you. So on that note, I am going to share my screen. This EMIS screen that we are looking at, it is a it's test environment, so there's no real patient data on here for us to worry about. The other thing to say is it's also a development site, so sometimes things on my system might not look quite how they will look on your system because we do have developers in the background working on things and making adjustments. So can I just ask whoever's not on mute, if you can just kind of put yourself on mute because we get a bit of feedback. And remember, this is being recorded, so you don't want that feedback on that recording. Okay, so searches. What are searches? Searches are a way of practices, PCNs, ICBs, of finding information of groups of patients who fit a certain criteria so that you may want to get in touch with them, you may want to do something for them. So they're very, very complicated or they are really, really simple. Quite a lot of practices write their own searches for their basic simple searches, but I always say a search is a little bit like asking your teenage son to put the washing on. He switches the washing machine on but forgets to put some washing powder in. Consequently, you've got dirty washing. And exactly the same thing is when you're building a search. Searches do exactly what you tell it to do. And if you forget one crucial criteria, then the results of that search are completely wrong. So to try and help practices, Ardens have provided a lot of searches for them to run, which means that they don't have the responsibility of building them themselves. We've got a team of people who, that's all they do all day. They write searches, so they really are experienced search writers. So hopefully it really saves practices, PCNs, a lot of time and work that they previously may have been doing themselves. So searches within your EMIS system, they sit within population reporting. To get there, you can click on the EMIS bubble at the top and go down to reporting. Or if it's somewhere that you're going to go frequently, then I would recommend you pop the on your quick access toolbar at the top here. So I've got all of the areas within EMIS that I go to really quite frequently up here so that I can get to them straight away, irrelevant of what part of the EMIS module I'm in. To do that, you just click on that little drop down arrow to the right there, Apologies if everyone's aware of this. You can click Customise Quick Access Toolbar. The left-hand side is all of the modules within EMIS that you have access to. The right-hand side is what you already have at the top here. So if there's any areas that you do want to add, then it's just a case of selecting it. Let's go down and say maybe I wanted the patient's problems on my quick access toolbar. You select it, you click on add, it will move it over to the right-hand side and you click OK. And that will then update at the top here, and I can see now this little red flag is the problem flag that will take me straight into the problem area of EMIS. So population reporting, as I said, it's this little search icon here, or from the EMIS ball down to reporting. And when you open up reporting, let me just close these folders up, sorry. When you open it up in a practice, at the top, you will get the practice name. So it will tell whatever practice you are in, their name will be at the top here. And somewhere amongst the A's, so these folders will all be in alphabetical order, usually names of people who work in that practice. And somewhere amongst the A's will be the Ardens search folder. Anything with an arrow to the left of it means there's content inside that folder. So if I click on that arrow, it opens up the content of the main folder. And as you can see, there are lots of other folders inside. Now, because there are so many searches, I'm actually just going to move to the training search site. Sorry, it will just be a little bit clearer. Because there's so many folders inside here, to try and make it a little bit easier for practices to navigate these search folders, we've tried to keep all the same sort of searches in the same place. So the numbers on the left-hand side of these search folders will always stay the same. And all the numbers that start with a 1.1, they're all searches around our reviews. So our LTC recall system, our diary recall system. Searches that start with a 1.3, they're all around administration. We've got searches that start with a number 2. These are all prescribing searches. So these are probably mainly used by your pharmacists. We've then got the searches that start with a number 3. These are all vaccination searches, so your COVID, your flu, your shingles type vaccination searches. All of our searches that start with a number 4, there are different types of conditions. Now, none of these searches are contract linked. They are just really good best practice granular searches based on that condition. So if any people in practices specialise in, say, diabetes, or respiratory conditions, then each of these folders have the same sort of searches inside that may want to be used. Then as you go down to the searches that start with a number 5, these start getting to your nitty-gritty of your contract searches. So all of your 5s, we've got QOF searches, we've got national contract searches like your weight management, you've got your network DES searches, your SMI, and CQRS claiming searches. So as you can see, there is an awful lot in there that practices can choose to use. The numbers to the right hand side of each of these search folders in brackets, this is the version number of that search. Now for all of your practices, we update them on a rolling 3-week basis. So every 3 weeks, the practice will get an email from us saying, we intend to update your search folders tomorrow. And then once we've done it, they get another email to say, we've updated your searches. So that means every 3 weeks, you will get all of the latest versions. So if any folders have changed, if we've done any updates to folders, then the practice will get them quite regularly. However, what we always make sure practices are aware of is we also update many searches on a weekly basis. We might create some new ones. We might find an error. There might be changes in contract coding, in which case we will make a change to that search over the weekend. And on a Monday, it will be available on our download portal for the practices themselves to go and download it and import it into their EMIS system, should they choose to. We only say to them they need to do that if it's something that they're going to be working on before their next update. So if we'd done some updates on Monday and they were aware that there were some updates to the network DES searches, but they were actually due a automatic update from us next week and they weren't going to be running any of those searches this week, then we always say to them, don't waste your time. Only download it if it's relevant for what you are about to do. And on our website, we also have an update button for them to be kept aware of what has changed. So on our website, if we went to support and support EMIS, sorry, ignore where this has gone now. It will go here. You get a button right in the middle there that says news and updates. And we always tell practices, keep an eye on this on a Monday morning, because that is going to tell you the date and what search folders we've updated. And we will tell you in the descriptions what we've changed. And then they can make that decision. Do I need the latest version of this folder, or am I quite happy with what I've got until my next routine update? So that was just a real quick overview of the search structures and how we keep practices updated. Just going to pause for a minute and see if anyone's got any questions. If you have, please feel free to take yourselves off mute, or I am going to keep an eye on the chat and have a look in that chat, see if anyone's got any questions. No? Okay. Okay, so let's go through some of these search folders and talk about some of them. Now, I know that some of you are responsible for recalls, you know, seeing patients who are coming in maybe who need a learning disability review, or maybe they've got mental health and you're doing a mental health review. What we have provided for practices is a month of birth recall system. I'm not going to go into this in too much detail because it is quite in depth, but what I am going to do when we've finished, I'm going to send Fozia, we've got instructions on how our recall systems work, so that if anybody wants to have a look at it in your own time, you can. So within this folder, if I open it up, I click on the arrow to the left hand side. We've got, as you can see, 3 folder number 1s, and that's because we've got 3 different versions of our recall system, and practices can decide how it's going to suit their practice to use it. The basis is still the same. The whole idea is that you are calling patients once for 1 appointment, or 2 appointments, but potentially at the same, on the same day. So when they run these searches, they specify what month the patient is born in that they want to recall. So they might say, show me everybody born in April, and the search will look for anyone born in April who has any chronic disease, they are outstanding a review this financial year, and the practice can then invite them in for them to have their review. So that's the basis of what that recall system is all about. We have filtered it slightly in System B and System C for practices who maybe send out self-booking invites. So in System C, we've broken it down by your different groups of patients of what sort of appointment they have. So generally we would say, book in for a diabetic appointment, because a diabetic appointment will cover all other cardiovascular conditions, or we might say book in for a respiratory appointment. So that is the basis of the LTC recall system. And as I said, I'm not going to go into any more detail in that, but I will send you instructions on it. The other recall system that a lot of our practices use is our diary recall system. And this is based on anybody putting a diary day into the patient's record for a review that they want them to have in the future. So maybe the patient has come in, they've had an LD review, but the nurse or somebody has been talking to the patient and they feel that they want them to come back before the year is up. They can add a diary date to the patient's records, and that can be pulled up in our searches here to say, these patients are due a recall next month, and you can send them out an invite for them to come in and have whatever it is that that diary date is stating. So that's the diary recall system. Now I'm going to go into some of the search folders and actually show you how the search is run, how you view the results, and the sort of things that we do have available. The first one I'm going to talk about, in folder 1.32, if I open that folder up, these are all appointment-based searches. So it might be that you're interested in patients who've maybe cancelled their appointments in the last month, or you may be interested in patients who are frequent attenders at the practice. So within each of these folders, I've opened the first folder, appointment related searches, and in that folder, you can see we've got 4 other folders. All patients with no consultations in time frame. Now that will show patients who've not been seen. They might not still be registered at the practice, so they've not had any consultations. And when we say in time frame, that means that the practice can decide when they want the search to look for. So you might be looking at, show me anyone who's not had a consultation in the last 2 months, or show me anyone who's not had a consultation in the last 3 years. So they get to choose the time frame. I'm going to find an easy search to run first of all. I'm going to use the frequent attender folder. So when you run a search, you can either run it at folder level. So if I open up the frequent attender folder, there are 1, 2, 3, 4 searches inside there. If I run it at folder level on the left-hand side, that will run all of the searches inside that folder. Now, if that folder is big, it could take quite a long time to run. If I'm not interested in the results in all of those searches, then there's no point in me running them all. So depending on what you want to get out of it, depends on how you run a search. If I was going to run the whole folder, on the left-hand side, I would right-click and select Run. Do you want to run all the reports in this folder? And if I click on yes, they're all going to start running. I'm not actually going to do that because I don't want to slow things down. However, if I was only interested in this very top one, patients with more than 10 appointments in the last month, I'm not interested in all the others. I don't want to run the whole folder. So I would just run one single search. So I highlight the search, I can do right click and I select Run. And I'm going to say yes. And this is going to start running. You will get an option in here that will say queuing. And when it's finished queuing, you will then get a population count of the results. Now, my system is a bit rubbish, so I've got no patients with more than 10 appointments. But for you, you might turn out with 10 patients in there. To view who those patients are, in the bottom half of the screen, you've got different tabs in the bottom. And the population included tab will give you a list of those patients in that result. Now I've got 0, so I'm going to get 0 people down here, but I will find a search in a minute where I do have patients. Now, that is a search, and you know it's a search because it is denoted by that magnifying glass. A search brings back a list of patients that fit the criteria that we have stipulated. A report looks like a piece of paper. It is generally indented underneath the search. And what that means is it is using exactly the same criteria as a search. So it's running off those results. So if I was to run the report, it will also run the search as well, because it wants to make sure that I've got the identical information there. When I ran the search, it just ran the search on its own. But when I run the report, we will see that when I click on yes, both of these will now queue, and they're both going to give me the same results. I'm afraid it's 0. So they're both queuing there. So it's always a little bit easier to run the report than run the search and then the report. A report gives you much more information. Depending on what we've put into a report, when you look at the results, instead of just giving you a list of patients, it might give you their name, their telephone number, their address, their EMIS number, and then depending on what the search is all about, details around that search. So in this folder here, we've got frequent attenders. It might be useful for you to know who's had more than 10 appointments in the last month. One that I think would be useful for you is down the bottom here. These patients, they have had more than 10 appointments in the last year, but they've not been offered social prescribing. So that might be something actually that your practices would find quite useful, because then they can get referred to social prescribing. They can come in and see a social prescriber and hopefully take a little bit of the pressure off the clinicians, the GPs and the nurses. So that was the frequent attender folder. Let's see if I can find a folder that actually got some data in. So here we've got the whole folder is called appointments cancelled and DNAs. In there, we can see we've got 3 searches. So there's 3 magnifying glass. And underneath these searches, there are some reports. Now, this top one, I'm not going to run it again because we have got some data there that you can actually view. So the top search, this is showing me all patients who have had an appointment in a certain time frame. So I will have set that time frame when I run that search. In fact, I am going to do that one again because I want to show you what that looks like. On that first search, I just clicked yes, I want to run it. But on any search where it says you set the time frame, when you select run and say yes, previously that just started running. But this time it's giving me a parameters box for me to choose the time frame that I want this search to look for. So the search is saying, show me patients who have an appointment within a certain time frame. So I'm going to say, okay, show me patients who've had a appointment after. So you've got different selections in here. After, and I'm going to use a specific date and the 1st of January. So this is going to show me anyone who's had an appointment after the 1st of January. Now, this date box in a search can be really quite confusing sometimes. So we always say to people who are quite new to search, well, even in experienced people, read the sentence at the bottom, because this will clearly show you what time frame the search is looking for. So this is saying if this was ran today, so for the 19th of March, this box is saying it's looking after the 1st of January 2024. And I'm going to click on OK. Now, because I ran the report, both that report and the search are running together. And it ran quite quickly. And I've got 8 patients in my results. So with the search, I go down to the bottom half of the screen and look at population included. And that gives me a list of those patients. Just move that up a little bit. There's my 8 patients. I can go directly to a patient's records from here. If I select the patient and I right click, I could go to their summary, their consultations, their medication screen. So I could go directly into their records to have a look at their records if I wanted to. But what is used most frequently on a search result is the bottom option that says check patient. This will show why the patient is in the results of the search. So when I select it, searches are all built up of rules. So if it passes the rule, and we've said include if it passes the rule, then they will be in the result. So here it's telling me rule 1, if the rule is passed, include in the result. If the rule is failed, exclude. So this search is saying include patients with appointments where the appointment date is after the 1st of January, because that's the date that I stipulated when I ran the folder. And it's saying, yes, it's found it. The appointment date was March the 12th at 1:45. Patient is included. So that's just information, but it's really useful information sometimes when you're wanting to know why a patient is in that search. However, the report is going to give you much more details. If I select the report, remember I said you can't view that data from down the bottom. To view the data on a report, you go up to the ribbon and you select view results. And as I said, there's much more information here. So it's showing me the patient's EMIS number, their name, their age, who their usual GP is. We've got their phone number, mobile number, the appointment date. These are cancelled appointments, DNA appointments and future appointments. So they will all be listed in the relevant columns there. To close the report, up on the ribbon, you've got a button there that says close, and that will just take you back to the search folder. So quite a few really useful searches in there. Those are showing anyone with any type of appointment. This search is saying, show me patients who've cancelled their appointment in a certain time frame. So many patients who've cancelled their appointments last month. And you would get the number, population included, would you give you the list of those names, and the report will give you those details that we just looked at, the date of the cancelled appointment, and if there are any future appointments. But we've got another report here. The same 3 patients, because it's all based on the same search. It's indented, so that means it's all based on that search above. But the icon is slightly different. What this icon is telling you is this is an aggregate report. So this search is not going to give you any patient names. It's just going to give you numbers. So when we view the results of this, it's giving me the numbers of appointments cancelled. So it gives you the GP and it gives you the number. So Dr. Dunlop had 1 cancelled, Dr. Jackson had 2, Dr. Pharmacist had 1, and Dr. Ryder had 3. When you hover over any of these numbers, you get a little hand icon, which means that you can select it, and that will then show you who those patients were. So that patient, although we've had 3 appointments cancelled, they were all done by the same patient. So those were your appointment searches. Any questions? Okay.
Sorry, Hazel, can I just ask, how do you actually get the aggregate report?
As in, you just view the results.
So does that normally just kind of come up between what is the actual search, then underneath you'll have a view report, and then it just comes underneath?
You will only have an aggregate report there if we've created one. Okay, so on many searches like these top searches, there is no aggregate report. We've obviously created one here because we feel it would be useful. If you have a search that you think it would be useful to have that report on, get in touch with us, and we can put it to the development team to find out whether or not it's something that we can add in there for you.
Right, thank you.
Okay, I'm going to move down to the next folder because this is still an administration folder, but this is an I'll get my words out, administration folder, all about your carers. And this might be something that you guys are interested in. It might be that you do carer reviews. You know, they're a carer for their LD patients, so they are entitled to a carer review. It's also very high on CQC agenda that practices are aware of who their carers are, especially their young carers. You know, have you got carers who are under 18? You know, that they take on a real big responsibility. Potentially they need a little bit more support, and it's really good if the GP practices are aware of who those people are so that they can offer that support should it be needed. So within this folder, you can see we've got quite a few folders inside. All carers, as it says on the tin, it doesn't matter what age they are. And then we've broken it down by age of carers, so 18 to 25, under 18s. And then we've broken it down by your type of carer. A long-term carer, we always recommend practices run these, especially at the beginning of flu season, because a carer is entitled to a free flu jab, but they might have been coded as a carer 20 years ago for their elderly mother. Well, obviously they're not still a carer. So just for them to be checking the patient's records to make sure that the data that has been coded is still accurate. You've also got occupational carers, and then your recently registered carers or new carers. So, you know, keeping an eye on these. They've just been classed as a carer. These patients could certainly do with a little bit of support or a little bit of contact, I would imagine. So each of these folders have similar searches inside. So again, we can run the whole folder, or we can open the folder up and we could run individual searches in there. So as we can see, the very top search, we've tried to make it clear in the title. If you're looking at a search and you can't see all of the title here, when you select it, the title then becomes down the bottom here. So if it was a long title, you would see it all along this blue bar here. So this is looking at all our currently registered carers. And for my test practice, we've got 4. If I want to know who those carers are, I can go to population included and I can see the names of those carers. Remember, a right click on any of that, I can go into their records, or I could do check patient to find out what code is putting them on this search. Now, remember, I've just said what code is putting them on this search. Searches can only extract coded data, which is why we always go on about how important a template is, because there are lots and lots of different codes in the EMIS system that you might want to use. But if you use a template, somebody else has already decided which of those codes you are going to add to the patient's records. And because Ardens create templates and searches, we know that all of the codes in our templates are going to be reflected in our searches. So here we can see that the code has been found on the 21st of August 2023. And the code that was put on the patient's records, a very strange code, patient themselves providing care. So underneath that search, we've got some aggregate reports. So the aggregate reports, remember, these are just numbers. And we know that it's an aggregate report because that blue bar gives you a column and a list, as opposed to the patient report that just had the bar across the top. So for each of these, I select it. This is going to give me a breakdown of the different age groups of those carers. View the results. And it's broken it down by the different age groupings, so within your 10-year banding. So we've got no carers between the age of 0 and 9, none between 10 and 19. We've got 1 between 20 and 29, 30 and 39, we've got 2, and so forth. And again, just like before, when you hover, if hand icon comes up, you can click on it and you can see who that patient is. Again, if I wanted to go to their summary, I could go directly to their records from here. So that breaks that down by the age of the carer. We've also got one that breaks it down by the type of the carer. So what type of carer code have they got? And we've got 2 who are coded as is a carer, and we've got 2 who are coded as patient themselves providing care. In practice, there will probably be a lot more codes in there and a lot more patients. And then the other one we've broken it down is by ethnicity. So we view the results, we can see the breakdown of ethnicity. In my practice here, because it's test environment, we've got very little data, so it's all unknown. And then we've got another search. So this search is still based on the results of all of our carers. And this is going to give us the number of carers who've had a carer health check. Search number 5, this is going to show me the number of people coded as a carer who've had a flu vaccination and in time frame. So that's me deciding what time frame. I would probably want to know patients who've had a flu vaccination, carers who've had a flu vaccination this financial year. So when I select yes to run the report, I get this date parameter box again. So here I might want to say after or on the 1st of September, because that is when flu season starts. I read the bottom sentence. If the search was run today, this is after or on the 1st of September 2023. So this search is now going to run. I'm probably going to get 0 in my results because it's test data. I doubt any of those 4 patients have had a flu jab. It's queuing. In a minute, we're going to get the results. You never know, we might get 1 in there. Oh, we've got 2. There we go. So I go down to population included to see who those patients were. And I can see those are the patients who've had a flu jab. Again, if I do right click and do check patient, it will show me the code that has been put on the patient's records to denote that they've had a flu jab and the date that that was added. So I can see here this patient had a flu code added and they had their flu vaccination on the 2nd of October 2023. And that's why they're included in the results of the search. If I want to know the patients that haven't had their flu jab, because this search is based on all our carers, I can go to the population excluded, and that will give me those other 2 patients who haven't. So these have been excluded from the search because they didn't pass those rules. So the rule was saying, look for the code of flu vaccination after the 1st of September. There were no matches, so this patient is excluded from the results of this search. Now, if a search is based on the whole practice, then I wouldn't recommend looking at excluded unless you really have to, because this top search here, to find out who the main search is based on, you can have a look here. In the details at the bottom, the parent population is currently registered regular patients. So that is who the search is basing its results on. Show me all the patients who are coded as a carer out of all of the registered patients. Now, if I was in a practice that had 20,000 patients, my results were 4. My population included would give me 4, but my population excluded would give me the other 19,990 however many patients. It would take a long time to load. So just be a little bit mindful about using that excluded tab if the main search has been based on, if we go back to details, the whole practice. Whereas this search here, I know that this one has been based on all currently registered because it's indented down the bottom here. So the rest of these searches in there, very, very similar searches, but they are showing you by different age groups or by different categories of carers. Any questions from anyone? Okay, I hope I'm showing you what is useful for you, because it's really hard to pick things out that I think are going to be useful when I don't actually know exactly what you guys do in your job roles. So I'm going to move on down to a few more searches. So again, please, if it's not relevant, just shout at me. Or if you want to ask, have you got a search for this? Have you got a search for that? I can see if we can find anything and whether we've got anything that's relevant. So I'm going to move down to now, I'm going to look at some frailty searches, because I'm also guessing that you probably are seeing frail patients. Maybe you're being asked to identify who those frail patients are. So when we go down to the condition searches, remember I said the condition searches all start with a number 4. We've got cardiovascular, we've got frailty, diabetes, respiratory. So the one I'm going to look at is this one here. 4.11 conditions frailty, care home, and end of life. Inside that folder, there are lots of folders. Remember, on the left-hand side, it will still display it on the right-hand side as well. It's a bit like your emails. When you click on it, the right-hand side displays whatever you've clicked on. Activity last month. This is just what has happened over the last month. So this is going to show you certain things that have been done for care home patients, frail patients, end of life patients, etc. Same thing goes for the activity last year. Alerts folder is looking at, alerts always means there's something potentially wrong that the practice may need to look at. Data quality searches are saying there is something wrong with the coding, so the practice would be advisable to have a look at any data quality searches. So these are relevant for care home patients. So remember, this folder is all about frailty and care home and those coded with end of life. So in this folder, we've got a search at the top that says the latest living status is temporarily in a care home, but it was recorded more than 12 months ago. So for your contract work, the temporarily living in a care home needs to be recorded in the last 12 months for it to count. So this is a little bit of a data quality search to show practices where they might need to go in and recode that patient's records. And again, remember, we've got a search and a report. So if I want to see the results of both, I can run the report, which will also run the search above it while that's running. We've also got a search in here looking at they've been recorded as being in a care home, but the practice have used a code that is not acceptable for their network DES contract. So that patient is not going to be taken into account. So at the top here, I've got one patient, population included, give me that patient. Right click and check patient tells me the date and the code that we're looking for. There we go. So it's looking for, it's saying include patients with a code of any of your care home codes. And the code we're looking for is the latest one, is living temporarily in a care home. And we can see that this patient had their this code on their records February last year. So it might be that we want to go in and have a look. Are they still temporarily in that care home? Have they moved back to their own home? In which case I need to add a new home living in own home. Or have they now moved permanently into a care home, which means I need to use one of the permanent care home codes. The report, view the results at the top, again, will give me much more information. So it gives me their EMIS number, their name, their address, and that care home detail. So there are some care home searches. I'm going to move down now to the frailty folder. So we've got a folder here that says frailty management and identification. The identification folder is looking at patients who they haven't been coded with a frailty diagnosis code. So sometimes practices will use an EFI score. An EFI score, the electronic frailty index, takes information from the patient's records and it gives a figure. So depending on how old they are, what conditions they've got, it then gives a number to indicate high, medium or low frailty. But that doesn't mean that the patient has been coded with a frailty diagnosis. The frailty diagnosis needs to be severe frailty, moderate frailty, low frailty. So these searches are saying they have one of those EFI scores on their records that suggests that they are frail, but the individual patient hasn't been actually coded. Okay, someone's just asked, what does EFI mean? It stands for Electronic Frailty Index. And it's something, it's a calculation that is done based on lots of different factors. How old a patient is, what conditions they've got, what their blood pressure reading is, what their BMI is, all lots and lots of different calculations, and it gives a number. So it might say, and I'm not clinical here, so I'm just pulling a number out of the sky. It might say 25, and that 25 might indicate that the patient is moderately frail. But this search is then saying, but nobody has actually coded that that patient is frail. So it's down to the practice to then go and have a look at frailty scoring. May well be nothing that you do. And getting a little bit technical again, the EFI score used to be used all the time. It is now seen as a little bit outdated because it calculates that score automatically. What is more frequently used now is called the Rockwood score. And what that does is it bases it on how the patient is, how the patient's walking, how the patient gets up out of the chair. And it's a individual calculation that a person actually does. So if I was to go into a patient's record and I open up a template, in a lot of those templates, there is a frailty scoring, and I'm now trying to think of a template that's got one in. Let's go to the over 75s. I'm pretty sure that has got So we've got a frailty and over 75 review template. And in that template, there will be a frailty page. So over on the left-hand side, all the different pages, there is the Rockwood frailty scale. We've now removed the EFI because it's not something that is clinically seen as being best practice these days. So we reviewed the EFI areas from all of our templates and replaced with Rockwood. So in here, here's the blue hyperlink that will take me to the Rockwood scale document. So this is what the Rockwood scale is. 1, very fit. People who are robust, active, energetic and motivated, they tend to exercise regularly and among the fittest of their age. So it goes down in different numbering. So the clinician would select which one they feel is the accurate number, and then they would go back into the template and they would record whatever that is. And then they've also got a frailty diagnosis. So from this, they're saying this patient is moderately frail, and they can go down and record that that patient is moderately frail, coding that with a frailty diagnosis. And that is what is then going to be picked up in searches. So there we go. So these are probably ones that potentially it will be your clinicians that will be using to say, OK, these patients haven't got a frailty diagnosis. We need to have a look at them and see whether they have. But then if you went into the next folder, the management, these are your patients who are frail. So these might be patients that perhaps you are responsible for. These are your severely frail patients, and these are your moderately frail patients. And these are patients that perhaps you might want to call in to have an appointment. You might want to be going out and visiting them. The main search is saying these patients have got a severe frailty diagnosis. And then, as you can see, all the other searches are indented underneath. That means all the other searches are based on the results of that top search. So this one is saying they've not had a falls assessment done. This one is saying there's no consent to enhanced summary care record. This one is saying they've not got a allocated named GP. So hopefully some quite useful searches in that frailty folder. And I am now conscious of time, that I've been rabbiting on for an awful long time. So I am going to whiz through a few others, just so that you're aware that they're there. We've also got learning disability folder in this conditions. And again, very, very similar searches in here. So alerts, looking at something that may need checking up on. But potentially for you, it may well just be the maybe the ethnicity reports. You want to find out of your LD patients who's got an ethnicity recorded and who hasn't. Oh, sorry about that. Moving on down, still thinking about learning disabilities. If we go down to the contracts folder, so we've got your network DES folder. In your investment and impact fund, learning disability is something that is part of your network DES contract for PCN level. So your patients who have got an LD, who are over 14, they should have a health check every year. They should have an action plan recorded, and they also need to have ethnicity recorded to meet the criteria of your IIF indicator. So in the work done folder, this will show you these are the patients who are in the cohort. So they're LD, they're over 14 since the beginning of March. Of those patients, we're in the work done folder. These are your achievements. So these are ones who have had a health check, they've had an action plan, and they've had their ethnicity recorded. More useful to you are the ones that haven't. So the work to do will show you those who haven't had it done. So again, it will still be population included, because this is going to show you patients who need a health check or an action plan because it's not been done. We've also got a data quality folder looking at where something has been coded slightly wrong. So your LD action plan has been done before your annual review, or they haven't got, it hasn't been completed, it's been started. So those are quite useful if anyone is interested in learning disabilities. And I think I've covered enough on searches. Is there any searches that anyone wanted me to look at? Because I am just going to briefly talk about some coding data and just briefly talk about the pink alert box that you will see in a patient's records. But from a searches point of view, did I cover the sort of things that you were looking for? Or has anyone got any questions? Okay, yeah, Marina's just asked about the time sensitive. Anybody else? Okay. 5.21 folder. This, we always say to practices, please run these searches regularly throughout the year, because for QOF, there are certain indicators where you only have a limited amount of time to do something. If you miss that time frame, it's tough. You don't get the QOF points. Patient care, yes, the work still needs to be done, but for QOF, you've missed that time frame. So in this time sensitive folder, we put all of the different indicators where there is that time element. And then inside each of those folders are very similar searches. I'll use one of the cancer ones as an example. So again, if I wanted to run the whole folder, I would right click and run on the whole folder. But if I was only interested in maybe one or two of the searches, I might pick the searches inside the folder that I wanted to run. So again, we've got a main search at the top, patients on the cancer register, and then they all go indented. So that means all the ones underneath are based on the results of the search above. These patients are on the cancer register and they are eligible for the 12-month review. Then you go down, it's indented again. So this is based on those who are eligible for their review. These have had that review. Number 2, these are outstanding. And what I would really recommend is you concentrate first on the search underneath that that says patients for whom there is still time to complete the review. So for QOF, completing that review within the time frame is what counts. So each of these time sensitive folders will give you a search that tells you that relevant time frame. So I hope that one was useful. Someone just asking about the occupational carers. So if we went back up to the carer folder, so it's folder 1.34, and in there you've got an occupational carers. So this is going to show you all registered carers, who they're registered as it is part of their occupation. You're going to get your report showing you the numbers, and then you've got searches of those who have had a flu jab, who's recorded as a long-term occupational carer, so it's been more than 5 years ago, or those that have only been recorded in the last 5 years. Okay, we've got 5 minutes left for me. Let's move on to talk about the pink box, unless anyone's got any more questions. I will keep an eye on that chat and I'll come back to it in a minute. But let me go back to a patient's record. When you're in any area of the care record, so the summary, consultations, problems and all of that, you will get a pink pop-up box down the bottom. This pink pop-up box is often where EMIS put their alerts. So there's something that you need to be aware of. Ardens have also created alerts that go down in this pink pop-up box. We haven't duplicated anything that EMIS have already provided practices to use. So it's always really helpful for you to know that this is one of the Ardens alerts, or whether it's an EMIS or a practice one, if you want to ask any questions about it. So when you hover over these alerts, you get additional information about that alert. So that ACE alert, the title is saying ACE or ARB monitoring advised. When you hover, it gives you more information. The following are missing. Now that has nothing to do with Ardens. I know that because it doesn't tell me in that box that Ardens have created it. Whereas if I hover over a different one, the blood test due, it still gives me lots of information about that alert, but at the very bottom, you can see it says alert provided by, and there's a link to our website. So that's how you know, that's how you know that that is one of the ARDENS alerts, as opposed to this one that doesn't say anything about ARDENS. This one tells you it's an EMIS alert. That doesn't say anything. The majority of them that don't say anything will be EMIS generated ones, but some of them could have been ones that the practices themselves have built. So they can create protocol alerts to show in the pink box things that they want their staff to be taking note of. On some of the alerts that ARDENS have provided, it also gives you the ability to open a template. So if we hover over the no ethnicity recorded one, this is telling you that it's an ARDENS alert at the bottom there. And it's saying this patient does not appear to have an ethnic origin. Double click to add. So that is telling me I can double click that alert and it's going to open a template with the relevant coding for me to select to add that ethnicity. Now in EMIS, there are loads and loads of their ethnicity codes. There are 18 approved codes that the UK government want practices to be using. And in all of our templates, the first option you will get will be those 18 codes. You will also get the option to add additional codes, lots of more detailed additional codes. However, these codes are not counted towards your contracts. So I would always recommend that you use the top selection of codes when adding ethnicity to a patient's record. So that was just the alerts in the pink box. Are there any questions on those? I just wanted to clear that up, that they are alerts that we can add. They're alerts that EMIS will add. And there's also alerts down there that your practices may have created and put in that pink box.
Hi, Hazel.
Yep.
Oh, hi. So with the ethnicity, coordinate ethnicity, I've been texting patients this ethnicity questionnaire that AccuRx have set up.
Okay.
I just wanted to double check with you if you knew that that was the right thing that I was doing. Like, would it sort of...
That's absolutely fine to be doing that. And I would imagine what normally happens with AccuRx, I'm not that familiar with AccuRx because when I was in practice, I used MJOG. But when they send texts out, they code in the background. And usually the practices will have double checked that that code that AccuRx are adding is an acceptable code for contract work.
Fantastic. I have noticed that a couple of them, and I've added it because when they've text back, I've added it to notes, and I've noticed that it does disappear from the pink box.
Yeah, that's fantastic. Then that means it is. And the other thing to also be aware of with ethnicity, you can also say that they've declined to give it. You know, if they decide they don't want to, then we have also included the decline codes, because for your network DES contract, if they say no, I don't want to tell you, these codes also count. So if you don't get any response, potentially double check with the practices first, but I would imagine that they will be happy for you to add the not stated code, because that will also count for your contracts.
Oh, brilliant. Thank you for that.
Okay, that's okay. So then you just go up to the top left-hand corner and you click save on that template. And the final thing I was just going to mention, and I'm not sure whether I've got the right end of the stick here, Fozia, but I just wanted to talk a little bit about coding. As I said previously, searches will only pull out coded data. So if you free text into a consultation, let's say I've got a consultation open and I free text, this patient is a smoker. That is not coding that the patient is a smoker. Okay, I need to add a code, which is why a template is good, because that code is being added in the background. But when you do add a code, sometimes you will see this yellow QOF box to indicate that there is a QOF acceptable code. The only thing I just want to make you a little bit of aware of, it may well be a QOF code, but it might be a QOF code for one domain but not another. There are several, I don't know off the top of my head, there are several codes for asthma and COPD that it might say QOF, but it might be a QOF asthma code, but it's not a QOF COPD code. So that's another reason why I would really try and get you to prioritise using a template if at all possible. But if you are adding a code to a patient's record, I'm adding breast cancer. All of the breast cancer codes come up here. If I want more information, if I want to see more of these codes, I can click on this box at the bottom, this option at the bottom that says Open Code Selector, and that will take you to the main code selector screen. But the yellow box is telling me this is a QOF code. So if I selected this one, it's not a QOF code, but this one is. And so is this one, and so is this one. Clicking on the code selector takes me here, which I'm sure you're familiar with, for things in a little bit more detail, because then you can actually select a code and you can see it on the right hand side and you can see what that code is if it's something that you need to be checking on. And that was me done. Fozia, have I covered everything that you wanted? Is there anything that I've missed out, or did I get the wrong end of the stick when you said about the little yellow box for QOF?
No, that's absolutely perfect. Thank you so much, Hazel. I really appreciate it. I mean, there's so much to cover, but I mean, of what you have covered, it's a brilliant refresher, I think, for all of us. But yeah, there's certainly more that we could do. So I don't know, perhaps we can call you back.
Yeah. Okay. Yeah. That's
Thank you
brilliant.
so much.
Just get in touch with us, you know, about anything that you feel that we can cover at another time, and we'll see what we can do to support you with that.
Amazing. Thank you so much, Hazel.
Okay, thanks everybody. Have a good rest of your meeting and have a good day. Take care.
Amazing. Bye.
Bye-bye.
Bye. Rosie, I'm just going to stop the recording.